Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic is titled Miscarriage, Allergies or Sensitization. When we talk of miscarriage, a cause is not all revealed. Even researchers have not all agreed on it, but there are certain miscarriages that is easy to explain, like when you now talk of asthmatic patients having this asthmatic attack and probably resulting in miscarriage, and that has been proven with researches. And then we've known of rhesus incompatibility, where we talk of hemolytic disease of newborn, the kind of miscarriage that will happen. But this effort of mine is geared towards seeing whether the allergies or sensitization, hypersensitization, or whatever we want to call it, whether it is truly what we call it, or whether most of miscarriages are due to these allergies or sensitization. So as we try to gather more knowledge on the slide section, I will urge you to press the like button and subscribe so that more videos will come from this my production, and we'll all be enriched more in health matters. The outline: objective introduction, definition of terms, lab diagnosis, prevention, and recommendations are what I shall be talking about in these studies. The objective: to create a deeper understanding of the association of allergic reaction or hypersensitivity with miscarriages, to help in early laboratory diagnosis and prevention of recurrent pregnancy loss. The introduction: these studies could be easily understood from the rejection of graft cells by our immune system. Generally, we know that these things are typed so that before they even transplant anything, like for example the kidney transplant, you must be tested and probably close in relationship before that will be done. And at times the kidney could be rejected because it is seen as a foreign body and attacked and destroyed. Many pregnant women show allergic reactions in the first trimester, and it is not far from immune reaction that is seeing the fetus as a foreign body that must be attacked and destroyed, which could easily be used to explain miscarriages. But researches are inconclusive so far. Every foreign body is first identified as an antigen that elicits a reaction from the body's immune system, which can be summed up as a hypersensitivity reaction. There are four major types of hypersensitivity reaction, namely type 1 reaction mediated by IgE antibodies, type 2 cytotoxic reaction mediated by IgG or IgM antibodies, type 3 reaction mediated by immune complexes, and type 4 reaction delayed reaction mediated by cellular response, which involves the T cell. Type 1 is an immediate reaction. An anaphylaxis shock is classified under it. The cell mediated response is a delayed kind of response observable with TB. You will find out that the TB, you don't see it quickly. No, the HIV infection, parasite infection, it takes time because the reactions are always cell mediated. It penetrates, and even some of them live inside the macrophages, and before they identify these T cells that really helps in identifying these cell mediated immune responses. Right. The allergic reactions involve the IgE antibodies that act on mast cells, dendritic cells, and other type of cells to pour out the histamine contained in their vesicles that will cause the allergic reaction, which includes also inflammation, and when it is serious, the anaphylactic shock. It has been found that histamine level can also rise once histamine degrading enzyme drop in miscarriage or preeclampsia, because generally when women are pregnant, the placenta prevents the rising of the histamine by producing this histamine degrading enzyme. The increase in histamine may explain miscarriage and postpartum hives and allergic symptoms, although these symptoms can occur during perfectly healthy pregnancy. And the finding of Westergrade, one of these and his co-workers, they've not found any difference between women with allergic rhinitis and healthy women in their study in terms of spontaneous miscarriage. However, like I had earlier explained, in women with asthma, the risk of spontaneous miscarriage is a bit higher than in healthy women. Yeah, we are on to definition of term. It is very necessary for us to understand certain terms because some of these terms are almost the same. I will explain as we go on. According to WHO, miscarriage is the spontaneous loss of pregnancy before the 28th week. It is a very common problem, 12 to 50%, that is 1 in 4 pregnancies. Therefore, you by the time you do a survey on so many women, they will tell you their experience with their miscarriages. The stillbirth, on the other hand, are babies who die at or after 28 weeks. And there are so many, 2 million, nearly 2 million. Recurrent pregnancy loss are those who experience this miscarriage continuously, probably consecutively 2 times, but if not consecutively, at least 3 times. That's what is classified as continuous pregnancy loss, and it's very necessary for us to know that this could also be prevented. Allergic reactions. This is where there is a bit of confusion. When you talk of allergic reaction, you are talking of the immune response. So a condition in which the immune system reacts abnormally to a foreign substance. That is, considering the asthmatic attack, the body will react in a way and stop cessation of the air coming, what is suspected as a foreign coming into the body, seize and even choke the person to death. Whereas sensitization too is also in that line. It is a reaction, but this time it is not immediate reaction immediately. It's a process, that is a phenomenon that increases a person's or animal response to a stimulus after repeated exposure. That word repeated. The first time when that experience coming, there are certain reactions, immune bodies, that is the immune response are produce something like a memory cell, so that when the next time it comes around, it will just attack it. And that is experienced with hemolytic disease of the newborn, the kind of miscarriage that one experience. Yeah, the laboratory is very useful in terms of whether it is before the first experience of miscarriage, before it really happens, or preventing a repeat of miscarriages, as it has been known that repeat pregnancy loss is a common phenomenon. So, if you look at this diagram, you will see histamine. Histamine is the chemical produced that really cause this allergic reaction, and it is an immune system sort of, that is, when you talk of what type of immunoglobulin is produced, it is the IgE. The IgE is the type 1, as earlier mentioned, in hypersensitivity. So this IgE is responsible for immediate reactions, and you can experience a serious one called anaphylactic shock or something in the semblance of an asthmatic attack. But the histamine produced in pregnant women, it can also be measured to know what level it is in the serum histamine, and also the serum IgE or skin prick test could also be done. There are need for us to, before the pregnancy is lost, to check the HCG, the human chorionic gonad hormones that is produced by the placenta. When it is low, it means there is seriously a miscarriage after pregnancy has been established. The value of histamine, like I said, can be checked. For the recurrent pregnancy loss, FSH, that is follicle stimulating hormone, TSH, all these other hormones touch could be done. Even the man, semen analysis and chromonal tests, biopsy, so many laboratory tests geared towards avoiding a repeat experience of pregnancy loss. There are so many, and that's a fact. Recommendations, finally. Prevention. Efforts should be made towards recognizing allergens that cause allergic reactions, like the cause of asthma or the type 2 hypersensitivity and the type of antibody produced by the B cells. The B cells is responsible for all immunoglobulins, name it IgG, IgM, IgA, and so on and so forth, for sensitization as experienced in HDN. So, they can be monitored by estimating their values and maintained at low levels, especially during pregnancy. Other traits are infections and quality of the sperm cell, which eventually may boil down to immune response involving either the B cells or the T cells. The T cells are involved for cell-mediated response, immune response. It is delayed because the experience of this reaction, the symptoms, is not quickly seen. The signs and symptoms are not immediately seen. You can talk of many bacterial infection and even viral infection as delayed response, but it is always involving the immune response. That's why this study is really geared towards understanding the role of these immune responses. It is clear that the immune response impacts pregnancy positively or negatively, and so properly managing allergies during pregnancy is important for the health of both the mother and the baby. For rhesus sensitization, that is the rhesus incompatibility, RhoGAM is given at 28 weeks of pregnancy and again within 72 hours after birth if the baby blood is Rh positive and mother is Rh negative, rhesus negative. We must accept that you can be sensitized without being allergic. So if you do not see any symptoms, it doesn't mean you have not been sensitized, but by testing, you may even know. But you can't be allergic without being sensitized. First, more knowledge on allergies and sensitization, I believe, will help reduce the incidence of miscarriage. And like I have always said, please view more videos on health matters. Our knowledge will improve, and since health is wealth, our wealth will also improve, because when you are very healthy, you can do so many things. Check the references.